Hi guys, good evening. I'm Niz and I will be your host for tonight. So allow me to introduce our speaker. It is my privilege to introduce our speaker for tonight. Our invited speaker completed his Doctor of Medicine degree at the University of the Philippines, Manila, and subsequently completed his residency training in otolaryngology, head and neck surgery at the University of the Philippines, Philippine General Hospital. He went for subspecialty training, undergoing finishing a clinical and research fellowship in rhinology and facial plastic surgery at Seoul National University Hospital, Seoul, South Korea from 2011 to 2012. He likewise completed a preceptorship in general plastic surgery at the North Coast Pan Plastic Surgery Center in Lorain, Ohio, USA. He is currently the head of the section of facial plastic and reconstructive surgery at the Medical City Clark, a vice president of the Central Luzon chapter of the Philippine Society of Otolaryngology, head and neck surgery since 2019. Currently the chair of the scientific committee of the Philippine Academy of Facial Plastic and Reconstructive Surgery. He is also the current head of the section of ENT head and neck surgery under the Department of Surgery at Pampanga Premier Medical Center. A faculty preceptor of Ateneo de Manila University School of Medicine and Public Health, and an international faculty lecturer of the Asian Plastic Surgery Society and the International Federation of Facial Plastic Surgery Societies. Currently an active consultant staff of the Department of Otolaryngology, Head and Neck Surgery at the Medical City Clark. Please join me in giving a warm welcome to Dr. Dennis Cristobal S. Mangoba.
Good evening, everyone. Thank you for joining us again at one of the Medical City Clark webinar series. So tonight, again, I'm Dr. Dennis Cristobal Mangoba. So I'm currently the head of the section of facial plastic and reconstructive surgery at the Department of Otolaryngology, Head and Neck Surgery at the Medical City Clark. So for tonight, our lecture will be Beauty and the Best, an introduction to facial aesthetic surgery. So this is the Medical City Clark. This is where we work. So are you familiar with this face? So ito yung Mukhasim commercials. This is part of the Mukhasim commercials of Dato Puti. So if you're familiar with this, this means medyo thunders na kayo. So ang sabi sa atin, kasalanan bang maging pangit? So kahit si Liza Soberano, may mga hugot lines she spawned a number of hugot lines. This is from her movie The X and Y's. So tanong niya, pangit ba ako? So a lot of netizens had hugot lines in response for this. Sabi ng isa, kung si Liza Soberano, pangit, paano pa ako? Anyway, sabi nila, hindi naman daw kasalanan kung pinanganak na pangit. But, sa panahon ngayon, pag may pera ka na, tapos pangit ka pa din, sabi, kasalanan mo na. So this is one of the most famous, more famous transformations. This is Sander Ford. So transformation. So we discussed what is considered as beauty. So when we look at someone like Liza Soberano, everyone agrees she's universally beautiful. And then Sonyo Jin of the famous Crash Landing on You. She was voted as one of the most beautiful actresses in Asia recently in 2020. So when we say beauty, there's a very simple equation with regards to beauty. So facial symmetry plus balance equals beauty. So everything has to be symmetrical and perfectly balanced. So we start with the facial analysis. So if we divide the face into fifths, they should they should all be equal. So the width of the nose should equal the width of the eyes. The two eyes should equal the two sides up to the ears. So that's what we call perfectly symmetrical, horizontally, vertically. I mean, and then horizontally there also also there should be equal symmetry. So from the hairline to the brows to the tip of the nose to the chin should all be approximately equal in size. So the horizontal third should also be symmetrical. So I'd like to discuss this. Um, there's a difference between cosmetic or aesthetic surgery and plastic surgery. So because for a lot of people they're considered synonymous, but actually they're not. So this is taken from the American Board of Cosmetic Surgery. So there's a key difference in goals and philosophy. So in cosmetic or aesthetic surgery, the procedures, techniques, and principles of cosmetic surgery are entirely focused on enhancing the patient's appearance. This means you improve the aesthetic appeal, the symmetry, and proportion as your key goals. Whereas in plastic surgery, the surgical specialty is dedicated to reconstruction of facial and body defects due to birth disorders, trauma, burns, disease, etc. So plastic surgery is intended to correct dysfunctional body areas and by definition is reconstructive in nature. So um, this is also taken from the training requirements of the American Board of Surgery. As you can see, only one of six is the required training category in cosmetic surgery, whereas in the American Board of Cosmetic Surgery, all required training categories are dedicated to cosmetic surgery. Because sometimes you can hear somebody say, "I'm a board certified plastic surgeon," but actually that does not say anything about the training required to do cosmetic surgery. So, so at the medical city, how can we serve you best? So we offer a lot of several services. So number one, facial contouring. Facial contouring, there's rhinoplasty or the nose lift, which can be augmentation or the standard nose lift where you lift it up, functional rhinoplasty to help with your breathing, or reduction rhinoplasty when the nose is already large. You can also do cheek or chin enhancement, and we can also trim the face by doing malar fat removal. And facial rejuvenation, or you want the patient to look younger. So facelift or rhytidectomy, blepharoplasty or eyelid lift for rejuvenation, or we can also create a double eyelid fold for the oriental eye. We also do brow lifts. We also do at our department in section of facial plastic and reconstructive surgery. We also do cleft lip and palate surgery. So we can do reconstructive trauma or cancer surgery. Then we can also do skin rejuvenation through Botox or filler treatments. So aesthetic surgery cases. So in blepharoplasty or eyelid surgery, as we always say, we for rejuvenation blepharoplasty, the indications are dermatocalasis or very lax skin with significant lateral hooding. I'll discuss it later. Or steatoblepharon, which is excess fat around the eyelids. So these two are actually acceptable for PhilHealth. So you can actually use PhilHealth to pay for your surgery. And then for the oriental eye, we can offer double eyelid fold creation. So, so this is a standard incision for the upper. Um, for rejuvenation blepharoplasty, we can remove excess skin and muscle together, and then for the excess fat, we can release it from central compartments, from the central or from the lateral compartments or the middle compartments. And then the lower incision is usually like this. And then we can remove fat or we can reposition fat. So this is before and after, after the surgery. Okay. So this is what we call significant lateral hooding when the vision is obstructed. So PhilHealth will pay for this because this is functional rhinoplasty. Again, significant lateral hooding on the frontal side. So now in augmentation rhinoplasty or the standard nose lift, we can use several kinds of implants uh, or grafts. So first, the best kind is autologous cartilage, meaning sourced from the patient itself. So we can use ear cartilage, we can use ear cartilage from the pinna, septal cartilage from the middle of the nose, or rib or costal cartilage, and we put it on the nasal dorsum. So we augment the bridge. Homologous cartilage is also sourced from humans, but usually from cadavers, usually irrigated cadavers. And alloplastic implants are synthetic implants, which can be silicone or expanded in PTFE or Gore-Tex. So this is the example of Gore-Tex implants. So standard L type. Before this was used significantly, but now we prefer using the I type. So this is an example of the silicone implants we use. This is from Korea, from China. So, and then this is what you use for the Gore-Tex. In cartilage grafts, we source from the ear, auricular conchal grafts, nasal septal grafts, or costal or rib grafts. So usually the incision, we make an incision here. And we either harvest here, the conchal bowl, or me personally, I like using also this. We incise here, then we harvest here. I use this as a strut graft to prop up, to project the nose. So this is where we usually use conchal cartilage from the ear cartilage, auricular cartilage. So we can use it on tip graft, shield graft, butterfly grafts, and so on and so forth. So because the ear cartilage is naturally rounded, we can make it look more naturally by using it on the tip. So you must remember when you are going for rhinoplasty to never allow anyone to put other than tissue here. So you have to put your own tissue here. If you put a synthetic implant here, usually it leads to fibrosis. And then this is the septal lengthening graft, or the septal extension graft, where we use the nasal septum. So nasal septum is sourced from the middle of the nose. So because it's a very straight piece of cartilage, unfortunately in Asians it's very small, we can use it to lengthen the nose like this. So we call this a septal extension graft. So this is the standard workhorse to elongate the usually small and short nose of Asians. So you must remember in going for rhinoplasty that we do not aim for the perfect nose. We aim for a nose that is perfect for your face. And then this rib or costal cartilage, so this is a separate incision altogether. So a lot of people will not go for this because it's very, it takes more time, it's very extensive surgery. So usually we try to harvest the straightest piece of cartilage. So usually it's the sixth cartilage. So in females, we make an inframammary or an incision below the breast. And then we harvest this is from the ninth rib, but we harvest the costal cartilage. Usually from the sixth or the seventh, which is the straightest piece. So this is an example of harvesting. So this is the cartilage we harvest. And then in functional septorhinoplasty, usually for crooked noses, it's either the septum is crooked and then we reshape it to straighten it because there's a problem in breathing. So usually the cartilage is divided into the nasal septum is divided into septal cartilage and very thin piece of bone perpendicular plate of the ethmoid bone. So depending on the severity, depending on the damage, we can either remove bone or put it back or reposition it, but usually we remove it and then the cartilage we can remodel it, we can reposition it. So from this, the vacant septum it transforms into relatively straight septum. So again here, the cartilage can be removed to shape the septum or to create more breathing space. But we have to retain enough support for the cartilage to retain its for the nose and the cartilage to retain its shape. So this is an example of CT scan view of the deviated septum. It should be straight, but it's deviated to the left, the patient's left. So you can see it's deviated markedly here. This is an endoscopic view. We use an endoscopic camera. We put it inside. So and then we can show this. So this is an endoscopic view again of this is an example of the septal cartilage being removed. We can use this as a graph for our rhinoplasties or nose lifts. We will remove it. So sample cases. So I'll show you some sample cases as representative examples. So in rejuvenation blepharoplasty, so we go from patient who looks like this to patient who looks like this. So from this to this. So usually we say, but this is in combination with the nose lift also. So usually we say that the patient will look younger by 10 years. Then the shelf life is usually 5 to 6 years. So this was the original look of the patient, and this is how she is now. So as you can see, good looking eyes and then transform into this. So you take 10 years off. So the patient looks younger, much younger. And then for the oriental eye, we can usually do this, where there's no fold. We can take out some fat, or we can just do minimal suture, double eyelid incision. So the patient the oriental eye will look much wider, beautiful. So augmentation rhinoplasty. So from this, the patient looks like this, and the patient responds to this. So this. So this is revision rhinoplasty. So the patient had already had the surgery done, but she was very happy with it. So if you look at her nose, it was still large, but she was beautiful enough. Then look at her. Then we revised her nose, took out the implant, put in another, and then this is how she was. So she was a beauty contestant, and she fortunately won. So we're seeing a subset of patients like this now. So they're the type of patients who are already beautiful, but who wants to look even more beautiful, from pretty to prettier. So we call it a staircase of aesthetics. If the patient is not so good looking, it's very easy to transform them from worst to bad, from bad to fair. But if you start here, if the patient's already very good looking and good looking, it's a much steeper climb. So it's a harder climb to transform the already pretty to prettier. So it's very hard to improve on perfection. But we're seeing a subset of patients like this. mostly beauty contestants. Ayan. So this is functional rhinoseptoplasty. So the patient came in with a hump nose, and then this is from a traumatic incident from his childhood. He was hit by with a pump of an artesian well, slammed on his nose. He broke his nose, but he didn't tell his parents, so he had to live with. If you can see the light reflection, the reflection is curved to the left. So after the surgery, you can see the light reflection is now straight. So the hump, there's a significant hump here, and the hump is now reduced. I wanted to do, if we call it camouflage grafting, but the patient didn't want to put any more grafts in. So, but he's very happy now. So if you look at the hump here, it's gone, it's now gone here. Okay? And then we can do cheek contouring with malar fat removal. So if you look at this, the patient was um, a little moon face, and then now she's slimmer, and then she decided to go for blepharoplasty as well. So usually patients will not be happy with just one procedure, and if they're happy with what you did before, they'll request for another. So this is how she looks after 3 weeks, I think. It's younger and face with a slimmer, the cheekbones are firm. For rejuvenation, for patients who want to look much younger with facial sagging, so this is one example of a patient. So she looks at least 10 years younger. So we did some for jowling by doing suctions, and then they will trim their face. And we also do cleft lip and palate surgery. So recently, the Philippine Academy of Facial Plastic and Reconstructive Surgery, I'm currently the scientific chair. We just concluded in last July our National Cleft and Craniofacial Awareness and Prevention Month. So we had a series of lectures through webinars, and then we held a video infomercial and poster contests. So cleft lip surgery. So this is an example. So to transform this, and now it's perfectly symmetrical, and the patient looks normal. So this is another example of a patient after the surgery. It looks quite good. Bilateral cleft lip surgery. We can also do cleft and palate surgery, and we can also do revision surgery for uh, not so ideal results. So this is how the patient presented, and this is how after surgery. So if you look at this, the cupid's bow is more symmetrical. So we can even address or at least reduce the asymmetry of the nostrils. So from this to this, and then so this is another patient, adult patient, wanted to look more symmetrical. So after this is just the first week. Unfortunately, he was an OFW who had to leave, so I had to leave right after the surgery. So I was only able to do post-op photographs. This is just 1 week after the surgery, so markedly different, but much different. So the patient looks it looks more natural. Even the nostril size is improved. And we can also do cancer and reconstructive surgery. So this is a Caucasian male who came in with a non-healing wound, so which turned out to be lip cancer. So we had to take out a wedge-shaped size like this. We had to take this out from And then we use this to reconstruct this upper part of the lip to reconstruct this lip in a two-stage procedure. So this was immediately after the surgery, first day. So mukha daw siyang Frankenstein, sabi ng kapitbahay niya. And then this is first week after the surgery. We took out the sutures. Second week, it's really improving, but the it's still not. So this corner is not connected to the rest of his mouth. There's an intervening tissue from the upper. So this is just his mouth opening. And this is so after 3.5 months, and then his mouth looks perfectly normal. So very happy camper. And then this is again another case of cancer. So we took out most of her cheekbone, maxillary cancer. And this is how she looks after. So she still looks normal. And so lastly, will you be happier with cosmetic surgery? Because nowadays, both men and women are becoming increasingly concerned about their physical appearance and are seeking cosmetic enhancement. In a 1999 survey in the United States, 56% of women and 40% of men reported dissatisfaction with their overall appearance. However, most studies report that people are generally happy with the outcome of cosmetic procedures. But we need to be especially vigilant nowadays. So we need to know when to say no because we cannot do surgery for all patients. So, number one, patients who have unrealistic expectations of outcome are more likely to be dissatisfied with the cosmetic procedure, regardless of the beauty of the outcome or how satisfactory the outcome is objectively. So, there's a type of patient that suffer from a psychiatric disorder called body dysmorphic disorder. So these people are never satisfied with cosmetic interventions, despite good or excellent procedural outcomes. So BDD is characterized by a preoccupation with an objectively absent or minimal deformity that causes them clinically significant distress or impairment in social, occupational, or other areas of functioning. So these are the type of patients we need to avoid. This we should know when to say no. So in patient selection, there's the ideal type. Ideal type is the Sylvia. So this patient is usually secure, young, listens, is verbal, very articulate, intelligent, and is usually attractive enough. Whereas the type of patient we need to avoid is characterized by the mnemonic Simon. So single, immature, male, overly expectant, and narcissistic. So, so classical cases of plastic surgery gone wrong. Of course, you know who this is. King of Pop, Michael Jackson. So he had underwent a lot of surgeries. So and he was transformed into this, from ethnically handsome to very strange. And locally, we have our local celebrity, Madame Aureen, who was fine to look at before. She had minimal plastic surgery, and then this is how she looks right now. So again, so thank you for listening, and let me end with this. So contentment does not mean that I desire nothing, but rather it's a simple decision to be happy with what I have. And John Newton says, "I'm not the man I ought to be. I'm not the man I wish to be. I am not the man I hope to be, but by the grace of God, I am not the man I used to be." So this is my upcoming webpage. This is still under construction. Please watch out for this. And if you have more inquiries, you can look me up at the medical seat or at these two hospitals, at Naman Medical Maternity Hospital in Malolos or at the Pampanga Premier in Napali, Pampanga. So again, we thank you for listening, and we'd like to remind everyone to be bright, to be brave, to be bold, to be beautiful, to be brilliant. So thank you everyone for listening.
Thank you very much, Dr. Dennis Mangoba, for giving an insightful and deep understanding of the common facial plastic procedures you've shared with us tonight. Okay, so moving on with our program, we received a couple of inquiry upon the registration of our participants, but aside from that, we will also be accommodating additional questions for tonight. Just enter them on the chat box and I will be reading them to our speaker. So, ready na po ba tayo for our
Thank
question
you,
and
Eunice.
answer
Okay,
portion?
go ahead. Can you hear me, Eunice?
All right, okay. So, first question is the procedure for facial contouring considered invasive?
Can you hear me, Eunice? Yes. So, any surgical procedure, any operation that will involve cutting into the tissue, making incisions, is considered invasive. Actually, even an injection is considered invasive. So there will be some types of procedures that we call minimally invasive. That's for other types of procedure. Like for example, for the thyroid, we can do minimally invasive surgery for the thyroid, and then for the torso, there's minimally invasive surgery also. So, but facial contouring in general is considered as invasive surgery. So,
All right. Okay. Thank you for answering that question.
so
Moving on, we have another participant who also asked, meron po bang allarplasty? Kasi ang ilong ko, gusto ko sanang lumiit.
okay. Thank you for that question. Balikan ko lang yung ano. So let me just get back to the previous question. So I think the question being asked for the first question was if, because right now there are some types of nasal enhancements or non-surgical nose lifts that are being offered. So in general, we do not advise patients to undergo injections to the nose. Why? Because it's very dangerous, especially if you put fillers. So um, our personal philosophy here is when we do enhancement, it has to mimic what naturally occurs. So, for example, if there's bone here, you just cannot put an injection here and expect to be natural looking. Of course, some people will say this is non-surgical, so this is safer. But in fact, you have to take that advice with a grain of salt, because if you inject directly into a blood vessel, then you can have disastrous consequences. So the nose can blacken, the nose tissue, the soft tissue can die. So if you inadvertently or accidentally inject into an artery. So but in general, nasal procedures or any procedure that entails cutting the nose is considered invasive. So
All
okay,
right.
with the second question, with aloplasty usually done when you make an incision into the side of the nostril to to um, to narrow the nose. But I think it should be the last procedure to be done in any nose lift. It's very easy to do. It's very easy to cut and then suture it back together. But once you cut it, you cannot replace it anymore. Because with narrowing of the nose, with inner plastics say we want the nose to become narrower. So one of the goals of doing a nose lift, we want the nose to be more refined, the nasal tip to be more refined, more elegant looking, or should we say more mestizo or mestizo looking, at the risk of being accused of having a colonial mentality. But um, we want the nose to become more refined. Usually, tailor plastic is done for wide nostrils, or in medical terms we call it the bulbous nose, yung malaki. So tailor plastic, kakat mo lang yan. It's a very simple procedure, but you can narrow your nose effectively and more naturally using other techniques, which should be the first stages. So usually I discussed before, I do the septal extension graft, which is the workhorse for noses, which are usually short, which are usually small,
small here with a small bridge, with a narrow bridge and a wide nostril. So when you do a septal extension, and maybe the various grafts on the nasal tip, you effectively narrow your nose already, you enhance it, you make it more elegant, and then that is the only time you have to consider scaleroplasty or cutting the nose here. So do not do it, do not have it done as a first step. So just have it done last step because usually you'll be surprised. You're request for an scaleroplasty, and after you've done all other things, including putting a dorsal implant, you find that it's not necessary. So you're left with a even more natural looking nose because you don't have an incision here.
Oh.
And then be very careful because I've seen some patients who have unfortunately very prominent scars here because of maybe the suture techniques.
Okay, Doc. Thank you for answering the question.
Yeah.
So moving on po. One of our viewers asked, how much would it cost for an eyelid surgery? Is it safe for a 52 years old woman?
Ah, maybe this is not the right forum to discuss prices, but
Mm-mm.
I'd be very much welcome to entertain you at any of our clinics in Green Hills. So you can also find me at Centro Estetico.
Mm-mm.
You can look me up. So my webpage is already up and running um, at Facebook on Facebook. So maybe this is not the right time and place to discuss prices. So because realistically speaking, prices will also vary depending on the severe on, on the intensiveness of what we will do, or how
Okay.
intensive the procedure will be. So yeah.
All right. Thank you for answering that question, Doc. Also, I would like to remind the participants who would like to book an initial assessment. You can book your initial assessment by using the link provided on the chat box para mas madali po natin ma-release ito. So we could entertain you one by one regarding your interview. All right. So moving on with another question. I have a growing jowl and I was wondering what could be done and how much would it cost?
I'm sorry, Eunice, can you repeat the question? I have a growing what?
Jowl, sir.
Jowl.
Yes.
Okay. Okay. With jowling and usually this is a I'm sure middle age or older patient
Mm-mm.
who desires facial rejuvenation, meaning they want to look younger. In short,
Yeah.
so jowling is also part of of um, the natural
Aging.
maturing of the
Mm.
face. So when the face becomes mature, we also have jowling. So when we do facelift, we also do um, um, liposuction. So the jawline is the jowling at the jawline is addressed. So you have a more defined jaw, and um, so again, I'm my apologies. We cannot. I don't think this is the right forum to discuss
Mm.
prices. So
Yes, Doc.
please come in for a formal consult. I think for a limited time only, we are offering free consults, free consultation.
Oh, wow.
So please get in touch with any of our
Mm-mm.
marketing people, or just come to us directly at the Immunity Center at the Medical City, or find me at any of my hospitals, or look me up online. And please, you can you can address your queries there. We will try our best to answer them. But it is always best to come in for a face-to-face consult. And I know this we live in uncertain times, during these COVID times, and
Mm-mm.
people are actually afraid, and rightly so, to be exposed for the risk of possible exposure to the COVID virus. People are hesitant to come in for a face-to-face consultation, but especially at the Medical City Clark and our other hospitals, we take great pains to ensure patient safety. So it's very safe so long as you follow proper procedures, wearing face mask, wearing face shields, proper hand washing. So it's very safe for the patient to come in for a face-to-face consult. We take we take pre-operative photographs not only to document but also to show you or show our patients what is really how we can work or what we can offer the patient, address their concerns regarding.
Yes. So I have to agree with Doc Mangoba regarding the safety here in the medical city. So for all our participants and patients out there, please do not hesitate to give us a visit. Okay, so for the next question, it goes, freckles on my face are getting darker and bigger. What procedure is the best for me?
Freckles on your face, so darker
Mm-mm.
and thicker,
And bigger, yes.
bigger, not
Yes,
thicker.
Doc. Yes, Doc.
I think that question is best answered by a dermatologist. So I can hazard a guess.
Mm-mm.
There are several lightening procedures
Yes.
can be offered, but I think that's best addressed by our dermatology colleagues.
All right. Okay, Doc. Noted po. Another question is, what is the latest trend for facial plastic surgery?
Uh, that's a very vague question. So, latest trend. I don't think, me personally, I don't go for what is just new.
Mm-mm.
We offer what's tried and tested, what is proven.
Mm-mm.
So, like like we were talking about nose lifts in general. So, some people will offer non-invasive, non-surgical nose lifts using
Mm-mm.
beds, using, using injections. But uh, personally, I think one, the results are never long term,
Yes, Doc.
and
Mm-mm.
when we do aesthetic procedures, we'd like to mimic um, what is naturally there.
Yes.
We don't have threads or fibers there. We don't have gels there. So, in the nose using injections or threads, um, I think there are there are better ways that will give you long term satisfaction.
Yes, Doc. And I believe not all trendy plastic surgery are applicable to everyone.
Yeah. So,
Yes.
I would like to advise them to be very cautious about trends.
Mm-mm. Yes, Doc.
So,
Ah,
it's not like technology that you always go for what is new,
yes, Doc.
then just buy it. So, go for what is tried, tested, and proven.
Proven. Correct. I have to agree. Okay, so moving on with our next question. What is the best nasal implant for nasal dorsum augmentation?
And thank you for that question. That's a very good question. So,
Yes.
we always say go for natural. So the
Mm-mm.
best implant, disregarding costs, disregarding longevity because of how expensive harvesting can be, is
Mm-mm.
using your own cartilage and using costal cartilage or rib cartilage. There are some touted disadvantages to it, like the- the- there's an issue called warping. Warping is when the
Mm-mm.
implant over time it distorts a little bit because of maturing of the cartilage. But there are ways to address that. So we have
Okay.
techniques to address to minimize warping. But
Yes.
always the best is your own cartilage. Why?
Mm-mm.
Because potential for infection is very low because it's
Mm-mm.
your own cartilage. So theoretically, your body will not reject that
Mm-mm.
particular graft. We call it graft. It's sourced from your body, as opposed to using synthetic alloplastic implants, which are
Mm-mm.
foreign, so they're considered foreign bodies. So in nature, they're foreign to you, and therefore um, they will the body will recognize it as foreign. So there will be some sort of foreign reaction. But of course, with the two alloplastic implants like Vortex or silicone has been here for a long time. So silicone implant, it's still in use. You can still do great things, amazing things with it. But the disadvantage of using silicone is that it forms a capsule around the implant, and therefore,
Mm-mm.
so this capsule is actually very slippery. So when you see a patient with a silicone implant, usually you can see that it moves, especially
Mm-mm.
if the surgeon did not put it in the proper plane, because the proper plane is putting it right next to the bone with the periosteal layer or the fibrous layer covering the bone, hugging hugging the implant, so the movement is minimal to none. And then
Mm-mm.
Gore-Tex, the advantage of Gore-Tex is because it's porous, so your own tissue will migrate and integrate into the implant, therefore securing your implant over time. But, but, let me emphasize again, never allow anyone to put synthetic implant in your tip, because we've seen that in so many patients. There's fibrosis, and the patient looks we call it the operated on look. So it doesn't look natural. So if you take the bird's eye view, the basal view, immediately, even if to the untrained eye, it looks operated on. Doesn't look natural, and maybe short term, you can get excellent, um, acceptable to excellent results with using a synthetic implant and nasal tip. But over time, it will degrade into something not very desirable.
Okay. So, thank you, Doc, for answering that question. So, medyo marami tayong questions for tonight. Another question, Doc, goes like, what is interdomal suturing for rhinoplasty?
Okay, so that's a technical question. So I'm not sure why. So maybe with internet. So interdomal sutures are just it's a technique popularized by the American surgeon called Eugene Carty. So he just so the dome here we call it the lower lateral cartilages
Mhm.
in an effort to make it narrower for a widened nose. You just put sutures in the. So it's a simple technique, very simple technique. Unfortunately, the results are very subtle. So if you're looking for a dramatic change,
Mm-mm.
uh, interdomal suturing as a standalone procedure is maybe is not should not be um, the only the
Advisable.
only
Mm-mm.
the only technique used. So it's useful in combination with other techniques in refinement of them, not as a standalone.
Mm-mm. Mm-mm. Mm. Okay po, Doc. So, well noted dun, Doc. So, okay, another question we received here in the WebEx. They're asking, what about recovery and scarring in the facelift procedure? So I think they're asking for how long would it take for the recovery and then yung scarring sa facelift procedure.
So downtime usually would be around 2 weeks. 2 weeks. So after 1 week, we take out the sutures. We take out some sutures.
Mm-mm.
But full scar maturation is always 6 months. So in order, so full, we call this full scar maturation. So for the body to complete its healing process, it takes usually 6 months. But downtime usually usually you will have hematoma or bruising,
Mm-mm.
bruising formation. So bruising will go away in 2 weeks, 2 weeks, starting 2 weeks. So maybe 2 weeks to 1 month. 2 weeks to 1 month. After
Oh,
1 month, you should be fine.
mm-mm. All right. So I think that's the last of our questions. Okay, so moving forward, Doc, thank you po for answering our viewers' inquiry and questions regarding, of course, the webinar for tonight.
So again, I'd like to thank you, Munoz, and I'd like to thank the audience for listening and for all those who asked their questions.
Yes,
So again, I think right now we have promotion, like free consultation.
yes.
So, good, so don't be afraid to come in for a face-to-face consultation because
Mm-hmm.
that's best. Because even with sending us pictures or going online to a video consultations,
Yes.
sometimes we miss some details that are normally available or evident to us in a face-to-face consultation. So please come to us at Medical City Clark and come and see me at any Raman Hospital in Malolos or Pampanga Medical Center, or look me up through my Facebook page.
Mm-hmm.
So thank you very much.
Okay, Doc.
Yes.
Okay. So allow me to move forward with our program. I would like to extend my gratitude and appreciation to our speaker, Dr. Dennis Cristobal Mangoba, for gracing this webinar. It's been an honor, Doc, and know that this will not be possible without you as our speaker. Thank you very much, Doc, for your time and support. Do you have anything else to say to our viewers, Doc?
No.
That,
So
that would be
I
all.
wish everyone a pleasant,
Yeah.
stay safe, everyone. And
Mhm.
once again, thank you for watching.
Yeah, so again, I would like to remind our patients and to all of you listening out there that Medical City is a safe zone for all patients. So I strongly agree with Dr. Mongoba's statement a while back that you can visit us anytime because we have standard protocols regarding the new normal protocols. I'm sorry. So to end this webinar, I would like to thank everyone who participated, especially our viewers. Thank you for patiently staying with us until the end. This is Nis, your host for tonight, and I wish you all a good evening.